a brain injury is at the heart of a case, the most important evidence may not be what's on the scan, but what a neurologist can see in the story behind it. I'm Kylie Como. I'm the nurse consultant here at Shane Smith Law. Today on Mind Matters, Navigating Head Injuries and Concussions, we're talking with Dr. Claudia Munoz, a neurologist who specializes in traumatic brain injury and serves as a medical expert in complex cases. We're going to explore why neurological expertise is so critical when a brain injury becomes part of a legal claim, and what makes these cases so different from other injuries. Dr. Claudia, it's a pleasure to meet you today.
Good morning. It's a pleasure to be here.
Excellent. Let's get right to it. I know we've got a lot of great content. Let's start with the basics. Dr. Claudia, could you kind of briefly outline your clinical background and your experience, say, evaluating patients with TBI?
Absolutely. So as a neurologist, I, like everyone else, went to medical school, and then I chose neurology because obviously it's the best discipline. I went to UC Irvine for my neurology residency, and then afterwards I went on to get an epilepsy subspecialty. So I am board certified in both neurology and then the subspecialty of epilepsy. So then I went into hospital neurology, which means that I did not have a private practice or an office. I'm the neurologist that you see in the hospital. So I took care of people and still do. To this day, I'm still a hospital neurologist at those critical, most acute times during their clinical course. So I've been doing that for over 10 years. And over the last couple of years, I started seeing cases that really kind of piqued my intellectual curiosity in terms of injuries that I was seeing in both elderly patients, really across the lifespan, but, patients coming in after seemingly mild injuries with a lot of problems. And so that started me down, I won't call it a rabbit hole, but it really started me down a path kind of looking into different ways of treating people, which in turn led me to really look into shifting my career in that direction.
It's fantastic. Yeah, you for the audience that doesn't know, that's kind of where I started in my own nursing career, working side by side with the neurological team, neurosurgical team in the neurosurgical ICU. So that critical point, those are some sick, injured people. Even though they don't look like it, they don't look like your typical ICU patient, right? A lot of times you may not have all those IV lines. They may not even be intubated, perhaps, but still, yet inside that brain, they are critically ill.
Mm-hmm. Absolutely.
Looking back, could you talk a little bit more about that? What was that turning point moment that led you kind of want to specialize in that subset of patients?
Well, I remember in my intern year, way back when, having one patient, and it's this young man in his, I don't even know if he was 20 yet, but young adult, and he was just obtunded, laying in the bed, not doing anything. He was not intubated. Obviously he wasn't able to eat by mouth, so he did have some tubing for nutrition and fluids. And I was like, why is he there? And he had been in a car accident, and the sheer force damage done in the movements suffered by him during this collision had led to what's called diffuse axonal injury. And he looked perfectly fine, pristine on the outside, but he was just not waking up. And I remember that being the first time just really impacted by that. And, years go by and I'm seeing more of these patients. And the turning point actually is, a colleague called me and said, would you be willing to talk to an attorney and give your expertise on one of their cases? And I was like, well, I've never done that before. Are you sure they want me?
Right. Who, me?
Yes, absolutely. And they said, well, what he said was, well, they asked me for someone that I trust and who is honest. And I was very honored by that. And so I agreed. And the experience was just really enlightening. It was really wonderful to see a team of people in the legal field who really care about their client and want the best outcome for that client. And we're really taking care of that person. And I had never been exposed to that. And so that was a turning point that really kind of said, oh, I could be a part of this. I could be proud to be part of this. So that was the turning point for me.
That's an excellent rundown. I think I resonate with that so well. I see much of the same thing now that I too am on the other side, I'm more on the legal side. I do see that the legal and the medical field just walking hand in hand in getting these clients, these patients, back to as close to normal as possible, if that's possible at all. TBI, it so often sits kind of at that intersection of medicine and law, as you alluded to. From your perspective, being a neurologist, why is your expertise so important in these legal cases involving TBI?
As a neurologist, and goes through our whole career, so the brain, the nervous system is exceedingly complex. And so much of my time, my practice as a physician, I would say, is what I call 20% customer service. And by that, I mean just talking to the patient's family, to their loved ones, people that care about that patient, and being able to explain what has happened, what is happening, and perhaps what may happen. And so that means I take really complex ideas, knowledge, clinical data, and try to put it into something that a regular old person, just normal human walking down the street can understand. And so at the crux of all of this, complicated medical, complicated legal, there's people, right? And so the neurologist bridges that between being able to talk to people and facilitate between people. And obviously we have that medical knowledge and expertise. So I see that as kind of, my main role, apart from seeing the patient, evaluating, assessing, and interpreting all the data. I really see it's at the end of the day, we're all a bunch of people and trying to understand something.
Yeah, absolutely. Much in the same way a translator, connects somebody who speaks one language to another. Yeah. You've got to be able to clearly help somebody else clearly understand a very complicated situation. Yeah. When, as you mentioned earlier, it doesn't look complex at all. The problem may not be evident at all. So
right, and everyone thinks it's in their head, and and everyone's anxious, and everyone is sad, and it can be tough. It can be a tough situation.
Yes.
And I think sometimes people look to us to kind of bring calm into that and reassurance.
Absolutely. For our audience, please leave in the comments if you've had an experience, if you've dealt with a TBI, or you love somebody that's dealing with a TBI. What have been some of your challenges in getting other people to truly see and understand that injury? Please, again, leave that in the comments below. Dr. Claudia, I know you kind of shared an example of a patient who drew you into that, that kind of realm of focus for your clinical practice. Can you share an example, without details, of course, of maybe a legal case, where your input clearly changed the course of that case? I hate to put you on the spot.
Yes, absolutely. No, absolutely. I can think of a few.
I'm sure.
Mainly, I think it has come down to bringing understanding to the fact that just because this person is out walking and talking, they're potentially back at work, they seem like they're perfectly fine. But when you do an evaluation and you actually talk to this person, you're asking the right questions, you are doing the correct assessments, and you're able to really tease out, yes, in fact, this person was functioning at their normal level, had an event, whatever kind of event that was that caused an injury, and now is functioning at a different level. And that level is still not normal. It's still not where they were. And they, although they're out walking and talking, are really suffering. They're anxious. It is, again, I know the brain lives in the head, the mind lives in the brain, but these connections have been disrupted in there. And that is real. It's not theoretical. And so being able to put together all of the data points, put together the history, the timeline into a cohesive narrative and be able to convey that to regular people has really made a difference for quite a few of the clients that come through.
Absolutely. Yeah. When I see practitioners like yourself, when we work with teams like yours, I picture an artist with a palette of different colors of paint, right? You've got all these colors, and then there's a blank canvas in front of you, and you are the artist, and you take each data point, each individual assessment, you paint this beautiful, clear masterpiece that everyone can look at and see, I see it now, out of all those little individual colors and pieces of info. So I think what you do is so critical. TBIs are so mysterious and so misunderstood. What makes those particularly challenging to evaluate in legal settings compared to, say, other types of injuries? Those more objective things.
Yeah, so humans are very visual. So many of our injured patients don't have a visual picture representation that someone can show and say, look at this brain MRI. You see that hole there? That's from that injury, right? Mm-hmm. They don't have that because the changes have occurred on a molecular level. And those are not detected on your usual conventional modalities, meaning an MRI may not pick that up. A CT scan may not pick that up. It doesn't mean it's not there. And so that's been, poses a challenge. It really does. But I think really falling back on the actual data that exists, these molecular changes are real. It's not theoretical. Going back to the literature, going back to the evidence, as a physician, always look at the evidence, always looking at the data, always looking at the research, always looking at peer-reviewed literature. I wouldn't be able to do this without doing that.
Yeah, amen. And those revelations, if you will, those diagnoses don't just happen overnight. Those things take time. Yes. to glean, correct? I mean, it's not a one done. You sit down for a couple of hours assessments. We're talking serial assessments over time to really get a clear picture. Correct?
That can be. Every patient is different.
Yeah.
Okay, I will say that every patient is different, and every person's path along this. But what I do tell people a lot is this is a work in progress, right? It may take time, but we will get the clearest picture that we can with the technology that we have to really figure out what it is you need in order to be your best going forward.
Absolutely. Be your best, build the best case, 100%. And you've mentioned tech a few times, and that is also an evolving field that's giving power and support to clients and patients with these types of injuries where they did not have those tools before in the hands of competent and physicians like yourself. So, with TBIs, why do these things go so frequently unrecognized or maybe underestimated during legal case reviews?
I think it goes back to we have our most common conventional imaging modalities. We have lab tests that everyone uses. We have, the reports of busy emergency room doctors who their focus is different than our focus. Remember, every specialty has the thing that they are very acutely focused on. So you go into the emergency room, they are focused on, is there imminent danger to life, limb, etc., body, eyeballs, or not? Right? Their focus isn't on necessarily the subtleties, right? And so through no fault of their own, these are many excellent physicians, but they're not focused on those non-life threatening, non-limb threatening things. So they have a patient and there's no broken bones, there's no skull fractures, no bleeding in the brain. Okay, great. You're okay for discharge, right? And then doctor, then the patient actually walks out, right? And it's not until days later that maybe the patient comes down off of that like adrenaline or that initial daze and realizes, oh my goodness, something actually did happen, right? And then that's where we step in to be able to recognize, okay, what you're describing probably means you suffered a traumatic brain injury.
Yeah, I think that's an important call out is, yes, you did go to the ER perhaps, and you were sent home, and just don't go home thinking you're okay now. Yeah, you've got to be on guard for sure. I'd like to really, talk to, the audience in that respect, people who are living with somebody who was in a recent accident or a fall and may have had an injury and got sent home. Dr. Claudia, what might be some of those red flags that should prompt them, or maybe even an attorney that already may be working with them or a clinician, to take a closer look for TBI?
Anything that is off. The most common symptoms that people report to me are feeling disoriented, confused, headaches, a lot of just kind of, it can be even full body pain and weird sensations, dizziness, feeling like they don't really fully kind of get where they are in space. All of these, it's just a brain that's just been kind of jostled and isn't really right. and don't underestimate that. I always tell people, start with your primary care. Just go, and then take it from there.
I think that's great advice. Get to a doctor, your primary care, one you trust, and just lay it out there. Hold nothing back. There is let them diagnose and evaluate. Don't try to self-diagnose and just brush everything under, because there could be some serious injury going on underneath the surface.
Yeah. Oh, and one thing I didn't mention, I'm sorry, in those common things, is I do get a lot of people who say they have this emotional response, right? And so many of us, especially men, are conditioned to kind of suck that up. It must, that can't be having to do with an injury, or, I'll be fine. But that's actually a chemical reaction in the brain. It's part of the whole package, right? So don't brush that off too.
Yes, 100%. Be on the lookout. Connect those dots from that recent injury to these unusual but subtle changes. Could be something. I'd like to ask our audience, especially those of you who work with injured clients or patients, what might be some of those signs that make you suspect that client or patient may have a brain injury? Please share those in the comments below. That could really help others who are listening and watching. Dr. Claudia, I think we'll kind of wrap it here. I hate to do it, but I do think we're going to have another episode. So let's stop here. How do symptoms that, again, these are invisible symptoms we're talking about. So how do these symptoms that are not visible on imaging complicate, legal understanding of brain injury?
They complicate it in that, again, these are complex concepts. Yeah. Right? And there's no actual picture. I can't bring up a brain cell, right? Because these are infinitesimally small. And point to, you see in this brain cell, and show a cascade. Humans are very visual. So it gets complex when you have to explain something that you can't see or look at necessarily with regular modalities of imaging. But you have to be very clear in laying out the cause and effect, or what your assessment is of the cause and effect. And also taking into consideration, this person was a human before you. They had perhaps a background of something that may be confounding to their symptoms, and doing your best to really tease that out, but having to be able to really set it out in a clear and as simple a manner as possible. And that's really tough. It is.
That is tough. You mentioned people with confounding comorbidities, whatever you want to call them. You're talking very young patients, or perhaps even older patients. Maybe there's some mild dementia set in, so absolutely kind of throws a wrench in the works of diagnostics. Correct?
Yes, correct. And I still do believe that, there's a lot of stigma around mental health issues. And so, a lot of people have underlying mental health issues. Does that mean that this is all in their head? No. No. It doesn't. And so really trying to just be as clear and as honest and evidence-based as possible really helps.
That's fantastic. And a final question for our audience. If you have experience in healing from, or maybe you're helping someone with a traumatic brain injury, what would you like people to know about these invisible injuries? Please leave your comments below. Everybody, that is unfortunately going to do it for today's episode of Mind Matters. A huge thank you to Dr. Claudia Munoz for breaking down why traumatic brain injury is so complex and why neurological expertise is such an essential component of treating these injuries, especially when they end up in the legal arena. If any part of this conversation sounded like your story, or maybe a client's or a loved one's, we'd love to hear from you in the comments. Your experience can really help others feel seen and help us shape future episodes. Please like this episode, subscribe to the channel, and share it with someone who might be navigating a possible brain injury. And remember, if you're in pain, call Shane at 980-999-9999. Take care and join us next time as we dive deeper into how neurologists approach TBI cases from an expert witness perspective. Take care.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.